Of corruption now, corruption endemic in the health sector and public hospitals, affecting the poorest of the poor, the most vulnerable in need of care. Well, the Health Sector Anti-Corruption Forum, launched by the President today, being seen as a possible step towards universal health care, aiding the NHI. The forum, a collaboration between government, business and civil society, follows the signing of the Presidential Health Summit Compact last year. That called for government and social partners to reform healthcare. So one of the signatories to this forum launched today, Corruption Watch Executive Director David Lewis, joining us now via Skype. David, thank you for being with us. There is a recognition that corruption is very widespread in health, but give us examples that you've seen. I mean, how bad does it get?
It's pretty bad. It's in procurement. It's in doctors and health professionals moonlighting, doing private work on public time. It's about people paying for hospital services that they should not be paying, right from getting into the queue to fill their prescriptions to getting treatment in hospitals. It's about drugs being stolen from hospitals and sold out of the hospitals. So it's a pretty bad story. And I'm hoping that this forum will go some way towards resolving it. I think it's a very, very strong initiative.
Well, how will the forum help? Or should I say, how will it even work to start off with?
Yeah, well, it's been working for a good couple of months. I mean, today was the official launch. But the way in which it works is that there are a range of stakeholders around the table. There are civil society organizations, there are law enforcement organizations, there are provincial departments of health, there are health regulators, there are professional bodies representing the private sector. There's an organization like the SIU, which convenes it very effectively. And basically, we all bring our various issues to that forum. We bring the complaints, the reports of the allegations that we get from the public. We package them and present them to the forum, and they are sort of triaged out to those who are most effective at dealing with them. So if it's a policy issue, it goes to the departments. If it's a law enforcement issue, it goes to the law enforcement agencies. If it's something that calls for a systemic investigation, it goes to the SIU. But what it does is that it gives us a forum for taking the reports of whistleblowers to those who actually have the power and the authority to deal with them. And it's a very sort of working type meeting. This is not a forum for grand speeches and big statements. It's a real working meeting. And, we are so positive about it that we think we have stumbled here, or we've all stumbled here on a model that, if extended to some other vulnerable sectors, could go a long way towards tackling corruption.
Well, we always say this is the collaboration that South Africa needs. I think you've even said that Corruption Watch has already worked with the Special Investigative Unit. I mean, are there examples where something has happened because of a sharing of information, say?
Yeah, we have worked with the Special Investigating Unit, and they're rapidly becoming an absolutely leading institution in combating corruption. They have significant investigative powers, and they have persuasive clout, let's say, in referring things to the NPA, referring things to the Hawks, referring things to government departments. And, they've done good investigations. The investigation of the Gauteng Health Department, which was done a long time ago and was not until recently acted upon in any way. But they've undertaken a lot of investigations, and in the short time this forum has been going, we've brought some matters before them that they have gone and asked for a proclamation to be issued, and proclamations have been issued, and they've investigated a number of things. It's a short time yet, but I'm expecting to see results, both at the policy level in order to plug vulnerabilities in the system for corruption, but also at the level of investigation and prosecution. And I think this is really, as I've said, I think a very positive initiative. I feel very, very bullish about it, actually.
The president also seemed bullish today and talking about the importance of this ahead of a national health insurance in South Africa. You don't want that to come in when corruption is so widespread. But will it be enough? I mean, the NHI is criticized, expected to be very centralized, this big machine with government firmly in the center. And we have, as South Africa, had bad experiences.
Absolutely. And from what I know about the NHI plans, there is undoubtedly a big prospect for the corruption of this vast centralized fund. And so, government have to, if they want the NHI to succeed, they have to ensure that it doesn't happen. And, I don't doubt that one of the things that this forum is going to be seized with is looking at that system and estimating on the basis of the experience that we have of health and other centralized funds, the vulnerabilities for corruption. And so, I think this is an essential part of the NHI, actually. And I'm hoping that it will help. It will help.
What about fraud in the private healthcare sector? And we're talking about this, of course, a day after the Competition Commission said because of the way private healthcare is working, people are being ripped off. What about corruption there?
I don't see why these are not able to be addressed in this forum as well. I think there is a big focus on the public healthcare system, for the simple reason that that's what most people in South Africa rely upon. And so if you want to, deal with the problems confronted by the least privileged elements of the society, that's where you'll be addressing yourself. But obviously there's a very strong interface between conduct and performance in the private sector and that in the public sector. So I don't doubt that these issues will surface there as well. And as I said, there are private sector representative institutions represented in this forum.
Finally, I mean, you were talking about whistleblowers, how important that is. What if people see corruption in health? What sort of mechanisms are out there?
Well, this afternoon or this morning, it was emphasized that they could report on the government hotline. That hasn't been such an effective mechanism. I can tell you, without using your show as a commercial, they could report to us. We get a large volume of reports on healthcare. And what pleases us about this forum is now we have a referral point to which we can take these. And so, our hotlines and reporting lines are open. I'm sure Section 27, which is one of the other civil society organizations involved in this, will similarly, take allegations to the forum, and then they can report on the public, the governmental hotline. But I hope that this becomes a feature of our society in which people get interested in the goings on at the forum and address it directly if necessary. The SIU is the sort of convening party, and they too would be a good place to take these allegations of corruption in the healthcare services too.
All right, thank you for your time this evening. Executive Director of Corruption Watch, David Lewis. So blow the whistle, and hopefully now there will be a strong action around corruption in healthcare.